I would love to hear from you what you are seeing these days. What's happening with kids? Who are your patients? And what are we going to do to prevent patients or kids from, becoming obese and sedentary and making sure they're getting good nutrition?
It is really rewarding to work with families and talk about cardiac disease prevention, which truly only exists in pediatric. Hey there, it is Dr. Renee and this is Dr. John and we are Dr. Vegetable.
So you're dealing with different people than maybe somebody that's in Idaho or New York or Florida.
And when I'm taking their dietary history, the parents are like trying to describe naan to me or chapati or dal or all these these foods that I hadn't historically eaten. But then I was like, I'm a practitioner, a large majority of my patients are Southeast Asian. I need to learn this cuisine.
Her work doesn't stop at the clinic. She co-founded Dr. Vegetable, a nonprofit that promotes nutrition and movement in schools.
So he came up with just making silly songs about fruits and vegetables.
That's the funniest content you and your husband have put out there, where you're doing these dances in your vegetable costumes. I absolutely find it hilarious, but it must resonate so well with children.
Exactly.
Yeah. Today's guest is redefining what it means to thrive in medicine. Not just for her patients, but for the physicians who follow after her. Welcome Dr. Renee Paro, a board-certified pediatric cardiologist and department chair of pediatric cardiology and pulmonology at the Palo Alto Medical Foundation. Trained at Stanford, she specializes in fetal and preventative cardiology, helping children build strong hearts from the very beginning. But her work doesn't stop at the clinic. She co-founded Dr. Vegetable, a nonprofit that promotes nutrition and movement in schools, and previously co-hosted the podcast Reconciling Medicine with her husband, a plastic and reconstructive surgeon. A Latina physician, first in her family to earn a medical degree, marathon runner, and mentor, she's become a voice for leadership and resilience in medicine. Renee, I am so excited we get to do this.
Sound very fancy when you say all of those things.
I know. I have to have a little bit of professionalism here because otherwise we would devolve very fast together.
Yeah, exactly.
So I actually have never spoken to you about what it is that you actually do. Obviously, we're good friends. I know that you're a physician, you're a pediatric cardiologist, but I don't know what day-to-day life looks like for you in the exam room. That part of medical school, I saw an EKG and I went running the other way. So I would love to hear from you what you are seeing these days. What's happening with kids? Who are your patients? And what are we going to do to prevent patients or kids from, becoming obese and sedentary and making sure they're getting good nutrition?
Yeah, so it's funny that you say that you hated EKGs in medical school because I did too. I started out medical school, did EKG lectures first 2 years, preclinical years, and was like, I will never be a cardiologist. Like the paper form, the way it was when you weren't looking at a patient, it was absolutely not something that I thought I would ever do. When I got into the hospital, it was more of a decision like adult medicine or pediatric medicine. I was in between OB-GYN and pediatrics. Ultimately decided on pediatrics, but still had no intention of doing cardiology within that. I thought I'd be maybe GI or hepatology. And then when I went to Stanford, first time really encountering a very robust pediatric cardiac specialty, and fell in love with the field automatically. And it was, again, more because of the practicality, the patient involvement, what it was like to see not only kids and take care of them, but be able to synthesize echoes and EKGs and cath studies and all the things that went hand in hand with the disease processes that kids experience. So, that's what drew me in from the beginning. I thought originally I might be a cardiac interventional specialist.
Oh, okay.
The cath lab is such an amazing place, and they can do such amazing things for kids, like putting in valves, putting in stents in these tiny kids, and it's a really thrilling place. But I had my son Micah, who at the end of my pediatric residency, and so I started fellowship with a 6-month-old and really started questioning whether or not I even wanted to continue to be a doctor at that point. I think most physician moms can kind of relate to that, where you have your kid and then you just sort of question everything.
Absolutely.
I had my kid, and then I was entering fellowship, so harder training that I'd ever experienced even in residency. So it really was a big sort of reckoning I had to do with myself. In my mind, I had always thought, well, when I have a kid, I'd be fine being in the hospital. I'd be fine, spending nights in the hospital and being a badass and then going home and be a mom. And then I realized I just had to really reprioritize what I truly wanted out of my professional career. And so, loved cardiology and thought, I could be a cardiologist and not do something interventional where I get called in the middle of the night or have to sleep in the hospital. So I really made the intentional decision to do outpatient medicine, really kind of checking in with myself. Does that seem like that's the right thing for me? Does that feel like that fulfills this professional satisfaction I'd want to have going into medicine? And realized that it did. Because, when I came into medicine, the thing I wanted the most was relationships with people. Mm-hmm. I wanted long-term relationships with patients where I could be a part of their life and walk them through journeys and just be an advocate for them and educate them and be someone they felt like could see them and take them through an experience. And so I realized that outpatient medicine was a great thing for me. And I actually realized that you go to a big program like Stanford, there's heart failure and electrophysiology and, multiple different specialties. And when you go through academia, you get this sort of feeling like you need to subspecialize. You have to do these sort of get pulled in all these directions. And the sort of reckoning in general with whether I wanted to be a doctor or not after becoming a mom, it made me question everything that I sort of had been sort of feeling like I was on this conveyor belt to go through. And I realized that I came into medicine for that piece of it. And so I felt very comfortable and confident thinking I want to be a general outpatient pediatric cardiologist. I did not want to do academia. Research was not my forte. And so I really wanted to go into private group practice, which I'm in right now. And I also had a really big desire to have incredible general specialists out in the community. So, so often when I would sit in these surgical conferences, we'd hear of patients getting referred in, and our physicians would lament about the care the kids were receiving elsewhere. And so I thought, you know what, I should go out in the community. A Stanford-trained pediatric cardiologist who knows the guidelines and understands one of their top fellows. I mean, I was chief fellow when I graduated from Stanford. And so I thought, who better than to go out into the community and provide excellent care to those patients? And so interestingly enough, I got some pushback from people at Stanford when I didn't accept a role that Stanford offered. I had 2 roles.
Well, they don't like it, right? Because they trained you. They want you to stay in academics. Yes. I think this is a great call out that you have here, that becoming a mom does not mean that you have to give up on your dreams. It also doesn't mean you have to plow through and do the thing that you wanted to do. It really does sometimes question those things, and I think that's good, and it shows that we in medicine especially can be happy in lots of different specialties. I say that often. It feels in the moment like you can only do this one thing, and you have to do this one thing, and you've been on that conveyor belt for so long. But it's really important for people to realize in medicine, not medicine, there are a lot of things you can do that can fulfill you and feel really good as you're mothering as well. But,
exactly.
So you went out into the community. Stanford wasn't so happy with that.
But they were happy. They weren't happy that I didn't take the job. Okay. But they were happy that I was out there.
Yeah, one of them was out there practicing good medicine.
Exactly. So, started out with my pediatric cardiology training in the hospital. Quickly learned, which I'm sure you are very aware of, that felt like I didn't know anything to go in the outpatient world. I mean, I was used to ICU care and cath care. I was used to all this really intense congenital heart disease. And then I'm going out in the community and I'm seeing chest pain and innocent murmurs and fainting and lots of general stuff that I had obviously the knowledge base behind, but that's not the stuff I was doing day to day. So it was actually a really big, I had to kind of readjust myself and get my balance again, because I was like, well, what is this random thing on the EKG? Do I have to freak out about it? When do I see them next? And outpatient medicine is just so different to figure it out. So the first couple of years was really just trying to get myself established in the community. My clinics were a little bit slower to begin with, so I got to build them up. And I actually got hired onto this position with the intention of doing some prevention, so preventative cardiology as a part of it. They didn't really need a full-time pediatric cardiologist in the location I was at, but they said they could make a part-time position that both included general cardiology and prevention and working with kids who are, higher BMI with a higher blood sugar, cholesterol issues. And I felt a little bit nervous about starting that because I just didn't really have much training in that. That wasn't a focus in my fellowship. But I also realized it didn't take much for me. I understood the heart. I understood cardiovascular disease. And so learning the guidelines and screening things was something I was like, I can pick this up and do this. And so little did I know that prevention would really become a bit of a cornerstone of my practice. Mm-hmm. Something that didn't just sort of fill my patient slots. A lot of the doctors there were worried that once I became pretty busy with general cardiology that I would give up my preventative practice. And I always assured them that I wouldn't do that to them. But it was because I actually really wanted to do it. And so then the reason why I have continued that as a part of my practice and will never give it up and see that as a big thing that I may do in chapters to come is that it is really rewarding to work with families and talk about cardiac disease prevention, which truly only exists in pediatrics. So I love adult cardiologists, love you, my specialty. I know there's a lot of preventative cardiologists in the adult world, but I truly, truly passionately believe that prevention starts in childhood. And so there are not a lot of pediatric cardiologists who do prevention. I have been a big vocal voice actually when I work with fellows and I talk about my preventative practice and get people more excited about it. And so I'm happy to kind of elaborate further on some of the recent guidelines and stuff if that works.
Yeah, I would love to hear the recent guidelines because I think what I'd like to kind of hone in on today is that we are, in my mind, facing somewhat of a crisis when it comes to social media and screens. Yep. And how that makes you more sedentary and also all the processed food. I mean, I know me and you grew up around the same time where it was everything was fat-free and so everything was filled with sugar. And we're facing other issues now. So much of our food is processed. And what are you seeing in your preventative clinic? How are you guiding these patients? What are you seeing? And what can we do to, in this world of a lot of being sedentary and eating that processed food, what can we do to combat that?
So these are all really great questions and things that got me very excited as I started my practice. And one of the things that ended up sort of pulling kids into my practice was in 2012, there were some guideline changes with the American Academy of Pediatrics. They recommended universal lipid screenings of all children between the ages of 9 to 11. Prior to that, the recommendation was that any child that had significant cardiovascular disease in their family or had other risk factors like obesity or high blood sugar should get their lipids checked. What pediatricians were noticing was that a lot of times people didn't necessarily know their family history, or there was a lot of kids that fell through the cracks from just having those as guidelines. And then as there is an increasing number of adults with cardiovascular disease becoming the number one killer of both men and women, there was some thought that, we need to actually just eliminate sort of the ways that people would get screened and just recommend it for everyone.
So all kids now should be having their lipids checked between the ages of 9 and 11.
Yes.
Okay.
And so this is important because it does capture some of the patients many of the patients where lifestyle parts of, lifestyle decisions on their part result in abnormal lipid panels. There's a lot of kids, though, that eat pretty healthily and have high cholesterol.
Genetics, I'm assuming.
Genetics, exactly. And, as I'm been in practice now for going on 10 years out of training and doing this type of care for the last nearly decade, I have seen that it's more and more genetic. And one of the things that I talk to a lot of families about is there is a little bit of this morality piece to cholesterol. Mm-hmm. Where when it's high, people automatically assume it's something that they're doing in their diet There is always room for improvement. I will say that with every single person, I myself have room for improvement in my diet, and I talk about this all of the time. But not as much as sometimes is out there talking about. So and there are kids where I've started many kids on statins, and I don't want to get this like aggregated and then people screaming at me with big pharma or any of that kind of stuff. Number one, there is a utility and a role for statins in pediatric patients and select patients who have high cholesterol. And it's a gradual process. It's something that we talk about. We always work on diet and exercise first and try to implement these things because everybody needs that. Even the kids who need to go on statins, we continue to work on optimizing their diet and exercise. But I do try to kind of bring that piece in because I do think that when there is this shame piece where there's this morality piece, it really affects kids and the way they feel about themselves. It really affects parents and how they feel like they are doing with their child. And so I try to kind of take a little bit of the gas off of that kind of viewing that and really dive into the genetics, which there is increasing number of people who have genetic related issues.
What is that nutrition conversation like? Because it's hard. I find it to be so hard. I mean, especially with children that are in sports and things like that. They're so active. They need to be fed multiple times in the day. And it feels like there's not a lot of options, especially if you're in a family that's busy, working, that's a lot going on. So how is that conversation when it comes to the nutrition piece?
I really refrain from talking about weight.
Okay.
In general. Even kids where it is a issue, I really refrain from talking about it, and I really focus more on the metabolic piece of what's going on. So if their blood sugar is elevated or their blood pressure is elevated or their cholesterol is elevated, we really hone in on that. And I make it, again, non-judgmental advice that's going to just remove the shame piece from it. And so we talk, number one, I counsel a lot about what is cholesterol. So that's my first question when a patient walks in. What's cholesterol? What is that? What do you know about cholesterol? I get a myriad of answers from kids. And so I'm able to sort of speak to what is this little particle we're even talking about? What does it do? Why do I care as a cardiologist about your cholesterol being elevated? What does high blood sugar do? Like, what is that doing in our body? It's, not sugars. A lot of times people think, well, sugar is going into blood vessels. That's actually not true. Sugar doesn't go into blood vessels. Cholesterol does, but sugar can make your blood vessels unhealthy. And then we talk about blood pressure. Why do we care about blood pressure? What does it do to your heart? What does it do to your blood vessels? And really get granular about what's going on inside of their body and why it's important to take care of their heart. We then talk about, the pathophysiology in very easy to understand ways. I have little models. I show them about what's atherosclerosis. Why do we care about that? We talk about blood vessels like highways of the body, and you want blood is like the trucks of the body, and it's carrying oxygen and nutrition, and you need your blood vessels to be nice and open with no traffic to get there. And we talk about how atherosclerotic plaques are kind of like little traffic jams that happen, and that's not healthy for our organs. Our organs need blood. Heart especially needs blood, and that's when you have a heart attack, and what do we have to do? So I kind of really go into detail about what it is and why they're coming to see me. And then I take it down and say, this is not happening in your heart. This takes years to develop. We talk about it now because we want to stop it now. So we go into sort of what's cholesterol, what's blood sugar. And then I take a full dietary history of them. So go like every single meal and snack time. What are we eating? And really, again, make it like this is just for me to glean some information about your routine during the day. This is not judgment. I don't care what you eat. I just want to know so I can best help you. And so I do a dietary history. We talk all about their activities and their exercise, and I call it movement. What do you do to move your body during the day? All the things that you do to get in a little bit of heart rate elevation. We talk about stress. So I talk to them about anxiety and stress and what does that look like? What do they do to cope with stress? What are their strategies? We talk about how that plays into elevated blood pressure and elevated stress hormones, which can change our body metabolism, how we do things. And then we talk about sleep and how does that affect you? And if we don't sleep well, then we get more stress levels. So I really take an all-encompassing sort of, I think of them as like the 4 pillars of health. What does that look like? I'm able to sort of speak to if we're having sleep issues and we're tired chronically throughout the day, it's no wonder why we're reaching for salty snacks at noontime. that's a trigger for you, right? I'm able to sort of tie all of their day together and point to places where maybe it's harder for them to get in some activity, or maybe it's harder for them to do we stress eat? Do we kind of just mindlessly eat when we have a big test coming up? Like, all of that plays a role. And I really try to get all of those things to specifically give targeted, tailored advice, because I can just give them nutrition advice. And contrary to popular belief, physicians do know a lot about nutrition. Mm-hmm. Like, we do continue to have increased learning past medical training where we all take on that time.
It is called continuing education.
Exactly.
Correct.
We don't stop at medical school or residency and fellowship.
Especially in your field, right? Like, you took on this preventative cards practice, and you probably had to do a lot of learning yourself.
Absolutely.
And I think this is something that a lot of people don't understand, is where you train might influence how you teach things and what you focus on. Because, say, I went to Columbia, and shoulder was very big there.
Yep.
And maybe foot and ankle was less. But then the onus is on us as the physician to go learn these other things.
Absolutely.
So I'm sure, just from what you're telling me now, you probably did a lot of continuing education on your own.
Yes.
To be able to counsel these patients. And so much of it is learned on the job with seeing your patients and seeing the same patterns over and over again.
Exactly. Like, I have a very large Southeast Asian population.
Yeah, see, so we're in the Bay Area.
Exactly.
So you're dealing with different people than maybe somebody that's in Idaho or New York or Florida.
And when I'm taking their dietary history, the parents are like trying to describe naan to me, or chapati, or dal, or all these these foods that I hadn't historically eaten. But then I was like, I'm a practitioner. A large majority of my patients are Southeast Asian. I need to learn this cuisine. I need to understand how it's being made. I need to understand that Southeast Asian populations have a very high vegetarian diet, and then we take the meat out, but then so then carbs are higher. So I had to learn on the job what I needed to do to make sure I understood people. Because I think you can talk till you're blue in the face about fiber intake and how much saturated fat to eat and all of this stuff, right? You can be a textbook person, but that's not going to resonate with your patients. You have to give them real world understanding. So it's like, okay, well, we have mom makes homemade naan. Awesome. What kind of flour are we using? Can we maybe switch it to almond flour? Can we maybe use some tofu inside of there, which is going to add protein and not as much carbohydrate?
I love that.
All of those things were things I learned over time. And so, and I am a huge proponent of using all of the members of healthcare for their expertise. I don't think that I should be giving every single nutritional advice or diet advice. We have incredible dietitians who we can, in our system, we're very lucky, we can refer our patients to, and they can spend a bunch of time really talking about serving sizes and different ideas for snack times and meal times, different ways to get in more fiber into your routine. And so I rely heavily on education, understanding what is cholesterol? What is all of this? What does the heart do? Why does it matter? How do we get these numbers down? Why is it important to get these numbers down? What are ways we can do in our day-to-day routine with adding in more fiber? And fiber is my biggest piece. This is why I'm Dr. Vegetable. I came up with the nonprofit because I would call. So the way that it happened was that my son, went to elementary school, and he brought home this one day very excited about the box tops. I don't know if people know about the General Mills box tops. He came in and was like talking about how this made money for the school and clipped the box tops, and I was infuriated because I was having all these kids coming into me who were really not understanding some of the challenges with processed food. And then here you see these big companies coming in and like, oh, it's to donate to the school. But what are you buying with those box tops? What are they coming off of? What cereal boxes and granola bars and all this kind of stuff, right? And
all the sugary stuff,
exactly.
Right? Mm-hmm.
And so I was pissed. I came home and I was telling John, I was like, this is crazy. And I had kind of made this moniker when I was in clinic because I would talk so much about the power of fruits and vegetables, how we can eat them. I am not somebody who says everything needs to be organic. I do not tell people it has to be from specific farms or whatever. Fruits and vegetables, however you can get them. Make sure that you wash them, the produce if you want, but get them frozen, get them canned, get them in any form that you can, just have them. Had to really do a lot of debunking about fruit causing diabetes. Fruit does not cause diabetes. And I had to tell them that. Like, it's the added sugars that come from other things. Nobody has ever gotten diabetes from eating too much fruit.
Yes.
Show me the person who's gotten diabetes from eating too much fruit. And so how to kind of debunk these things with parents and have them understand that. And so I would joke about fruits and vegetables and I say, I should just change my name to Dr. Vegetable. That's like what I would say in clinic. And so then when I was angry and John was like, all right, she's mad. What can we do? Because we believe that you can't just get mad about something. If you're going to get mad, you got to actually come up with a way to fix the problem. And so he was like, we should make a healthy versions of the box tops. And I was like, that's great idea. So then we implemented a shop crops, not box tops at our elementary school.
That is wonderful.
And
how did that go?
It was amazing. So I have a friend who works for the AHA. The goal was like only for the kindergarten classes that year. Went in and just presented to them exactly what I talk about in clinic and made it fun. John is a plastics and reconstructive surgeon. He also is an incredible musician and can come up with things. So he wanted to be involved and I wanted him to be involved. And so he came up with just making silly songs about fruits and vegetables. And so we sort of tag teamed this assembly with the kindergarten classes, and I was Dr. Vegetable in my white coat, kind of talked about everything. And my friend who worked for the AHA had these like silly vegetable costumes she heard about.
Oh, those are the funniest. That's the funniest content you and your husband have put out there, where you're doing these dances in your vegetable costumes. I absolutely find it hilarious, but it must resonate so well with children.
Exactly.
Yeah.
So he put on this vegetable costume. He sang silly songs about pee and how like this thing come out in your poop, and this is why it's important. All this stuff. The kids died laughing. They thought it was so funny. They went home and so then we just gave them a little sheet. They had to like put little stickers or write off if they had fruits or vegetables. And then when they turned in their sheet, we were like, for every sheet, we're going to give a certain donation to the school, and we ended up donating. But I had these parents who were emailing me, and they were like, my son came home and for the first time, like I've had these bowl of vegetables on there, and he asked like, what's that? What's that? And he's like, it's this thing. And he's like, is that a vegetable? And they were like, yeah. And he was like, you need to make that for dinner tonight. I need that in my body because of my cholesterol and Dr. Vegetable.
Wow.
Kindergartners. And so what we realized was this sort of very unique thing of like, if you are willing to look stupid and silly, kids will eat that up, especially elementary school kids. And so, it was a huge success. And then we were able to expand it to the entire school the following year. And then COVID happened, and we had a lot of vision to bring it out to other schools in the area. We actually developed it and made it into a nonprofit. So Dr. Vegetable is a 501c3 nonprofit. And we lost our steam a bit with it, but we didn't want to let it go. We kept sort of things going and recently have revitalized it. Before my son left for middle school, we did it with the 5th grade class that had done Dr. Vegetable before.
Oh, that's great. So they saw it again.
They did it again, and then this year we started a run club at the elementary school, and we do the same thing. Every parent who volunteers has to wear a vegetable costume, and the kids, we talk about the importance of running and how that helps your heart. And so it's really becoming a big, way that it's that I'm trying to push forward the notion of entire heart health. That's diet and exercise, that's sleep, that's running, that's stress, that's relationships. You talk about, so that sort of segues exactly what you're talking about, screens and obesity and all those things. I am really realistic with kids in clinic. I ask them about, their video gaming. I ask them about iPads. I ask them about all those things. And I, again, am from a non-judgmental approach, say, you guys are growing up in a generation where screens are necessary, where video games are helpful building blocks to figuring out certain things in the world. We are increasingly going into
social, because
AI world.
Now people are playing these like Roblox games with their friends. So
exactly.
When it used to might be like that you were riding your bike with them, they're inside playing these games. It's hard as a parent to say no to that.
And it would be so disingenuous if I acted like my kids don't play
video
games, that my kids don't go upstairs on a Friday night and go watch an iPad so that their dad and I can have some time just to hang out with each other.
Which is so necessary as well in this fast-paced life that we all have.
So I, again, try to present it to them as education, that these things are important, but we have to know what they're doing in our life. A lot of times they'll bring up their screen usage when I ask them about things that they help to reduce stress, and I let them know that yes, it's a way to sort of disconnect, possibly use some social, but those aren't that time spent on those devices aren't doing much to actually benefit their stress level. Other things like exercise, other things like talking to their friends, other things like drawing, painting, I actually talk a lot about play. So I ask them a lot, like, what did you do when you were a kid? Like, what was the thing you always asked your mom and dad for? Did you like Legos? Did you like to draw? Did you like to play Barbies? And they will kind of get a little like shy, and then they'll say what it is. And I'm like, why can't you still do that?
Yeah.
Like, why did you stop? Like, one of the things we are recognizing a lot is that adults don't have play in our life, and it is really affecting us significantly. So I talk about that again, and then we talk about, so I again try to let them know that screens are a part of their lives and that they shouldn't feel guilty about those things, but they have to understand how they're affecting their lives. So if we're on a screen, like if it's hard for us to not play video games for hours and then we get into a fight with our parents, then maybe what we should do is set a timer ourselves for an hour. And when that timer goes off, you're not going to want to stop. You're not going to want to stop, but you have to do that. And because you have other things you need to get done. So again, I've tried to really kind of interlace it in a healthy life, because you truly can have all of those pieces and live a healthy life. We just have to figure out how it's fitting into our day.
Just be more balanced. So on the other end of the spectrum, do you see any in your practice, any athletes, and what are they dealing with? Because there's so much from an overuse injury perspective that I'm seeing. So what are you seeing in their nutrition, or what's going on with their heart?
So a lot of the patients I'll see that come to me from athletes, it's that they're not able to sort of hit their goals, or hit their they feel like their capacity is decreasing.
Oh, okay.
And when it comes down to, and so they're worried that possibly something's going on with their heart. Like, they were like, well, in last sophomore year, I was able to run this fast, or I was able to do these hours and hours of training, and now I can't. And obviously it's not only this, it can be multifactorial, there are things, but I then sort of go into the same exact thing. I take a dietary history, I take a sleep history, I take all of this. And what I am able to glean from it is you're overtraining.
Yes.
You're overtraining. Every single exercise you're doing is 100% all of the time. And as an athlete myself, I have had to come to understand how important it is to have true rest days, to have days where you're doing your exercise, but you're not doing it full out. And so these kids are not, and they're getting what they think is enough sleep. But when I actually add up their day, I'm like, you are in all these AP classes when you're at school. You're then training in your sport for an additional 2 hours every single day. You are very much under eating your carbohydrate intake, because you need carbs to be an athlete, because there's just all this demonization from the outside. Of course you're tired. Yeah. You're maxing out. You need to build up more of a low-end aerobic capacity. And, I think that coaching is getting better, but there's still a lot of coaches out there who do not give good advice to their athletes and push them to this point where they are overextended, getting injured.
Well, because they're playing multiple teams of the same sport. They're specializing in one sport all year round instead of doing there is value to swimming and soccer and baseball because you're cross-training. You're teaching your muscles and your body to do different things, and you're decreasing those overuse injuries.
But when you are competitive, if you're a kid who's doing all of those sports, are you actually pulling back in any of them?
No,
you're going all out in all of them. And they can take it, right? They have healthy bodies. They have healthy hearts. Like, they can take it much further than this, 42-year-old body can handle. But, everybody maxes out to a certain degree.
Yes.
So it's really talking with them about smart training and pulling back sometimes. And for my runners, doing easier runs. Don't always run super fast all the time. I speak on that from personal experience. I know. And that piece is very helpful for my patients, because when I can say to them that I am this going on my 14th marathon, I, have a really fast pace where I qualify for races for my age. This is my sport. I take it very seriously. So having that, if I wasn't sort of living that lifestyle for my patients, they wouldn't take my advice so seriously. But when I talk to them about what I do and how I get up this morning at 5 a.m. to run 23 miles, training for my next marathon, I have credibility there, and they listen.
That's great. So that's a great segue. So tell me what you've learned in your own fitness journey and how you've incorporated some of these teachings into that. And then tell me how you balance that endurance training and that strength training as well.
So I grew up an athlete. I played multiple different sports growing up. Didn't play it in college, but I always just big team sports, softball, basketball, golf, tennis, bowling, everything you could think of was in everything. And then I, probably like everybody in medicine can understand, just was like, well, I have to just study all the time. And so I kind of gave it up and I stopped exercising for a while. And for a while that was okay. I would do little things here and there. But in fellowship and residency and fellowship really tanked in my feeling like I was burning out. I had my lowest period of burnout. And when I started reprioritizing exercise as my sort of cornerstone piece, everything changed. And so from there I realized exercise makes me me. Exercise makes me feel balanced, and I'm able to get better sleep and eat better and do all of it when exercise is my most important piece. And so I ran my first marathon when I graduated from medical school, and I ran that in 4 hours and 5 minutes. So that was, wow. I decided I'm going to do it. I'm going to run my first marathon the year I graduate from medical school. I'm super proud of myself, thought I was going to be one and done. And then I saw the Chicago Marathon and was like, okay, well, maybe I'll run one more marathon because it's a super cool marathon. And I trained for that after my 2 kids. So this was 9 years later. And I ran that one in 3 hours and 17 minutes.
Oh, my. 14 marathons later.
Still working on trying to PR a little bit more than that. But it's still and I was hooked. I was hooked on the marathon scene. I think it's the most incredible place, from the runners to the volunteers to the people who cheer for marathons. It's like the energy at a marathon is the best of humanity. I honestly think more people need to just go to marathons, and so much more will be better, because these people are doing, everybody who's running that race has a specific reason why they're doing it. They're not just kind of showing up on that day. Well, maybe some people do, but most people
are training for that.
It's a big thing.
They have a goal.
Exactly.
They're doing it. Sometimes they have a mission for why they're doing it.
Exactly.
Too.
And I'm an endurance athlete. I could do cardio all day long. Biking is not my favorite, but I'll do it. I like swimming. I like all of it. And I had to... And I had some understanding that strength was important. Definitely between my first marathon and my last one, I was doing a decent bit of strength. I had really kind of bought into, you need to be strong. I also, because of many things, including my strength, became a faster runner. And so I recognized the importance of it. And then I've also now, 6 years later from my second marathon that's kicked off this journey, have realized that strength has been my saving grace in not getting me injured. I've seen so many marathoners who only run, and they'll have hip injuries, knee injuries, ankle injury. They're getting all of their, and I really think so much of the reason why I have continued to be able to do this as long as I have, and do at least 1 to 2 marathons a year, is because I prioritize strength training.
But that must have been a huge mind shift for you, because from what I know from cardio junkies, myself included, but I actually can't do it anymore because I injured myself so much. And probably that's what just happens in your 40s, but you have to cross train. You have to do the resistance training. But I know your personality well enough to know that probably kind of made you mad, that you had to do this other thing, and it was taking away from your endurance training.
I just want to run. Want to run. I always want to run. It's my therapy. It's my headspace clearing. It's where I have my best ideas. It's running is a passion of mine. But I know that I want to run forever. I want to run as long as I'm on this earth. And in order to do that, I have to be smart about it. I have to take that ego part of myself and check it significantly. And so that is what makes me do a better job. When I'm not, and I really, I did 3 marathons one year and realized that's too many, because I have to have at least a portion of my year that is dedicated to strength training and only strength training. That's the way I'm going to be able to build the muscle that I need to build and maintain the muscle as I get older, so that I can keep doing that. So that's been a big piece of it, is that I have to space out my marathons. I have to be smart about how I do that. I'm working with great coaches. Recently started working with a company called Eternal, which is really, really motivated in prolonging athletes' ability to do their exercise for the long term, and make sure they're thinking very smartly about how do you have a long lifespan and health span. And health span is what do you want to be doing when you're 80? You have to be thinking about that right now if you want to be able to do this at 80. Like it takes daily intentional effort to do it.
Definitely. And I think a hot trending topic right now is your heart rate zones. So what have you learned about that as not just a cardiologist, but also in your own training?
So this probably comes as no surprise to anyone, but I am intense.
Yes, you are. You don't like rest days or
intense.
Slow days.
And so when I'd have a easy run on my schedule, I'd be like, oh yeah, I'm doing it easy. And then I'd be like running super fast paces.
Yeah.
Because like, that's my easy pace. I'm like, no, it's not. Shut up. It's not your easy pace. And so actually through working with Eternal and just this company that really focuses on metrics is VO2 max testing, bone density testing, labs, all those things. I learned that what I kind of already knew, that I am a super, I work very well at high intensity paces. My body can pretty much survive in like a lactate, like swimming around. It just is like, well, I kind of live here now, so I have to be better at it.
She's done this to us
right?
many days in a row.
But when it came to that lower end intensity, my body did not know what to do. My heart rate would jump up at even slower paces. And so actually this training block, I've really put an intentional focus of keeping my heart rate in a zone 2 intensity. And it's really freaking hard, really hard, because I have to pay attention to my watch. I can't just go based off of how I feel, because I feel fine at heart intensity. So that has really improved my, well, we'll see. I have a few weeks until I'm Chicago Marathon again, number 5, and Chicago Marathon number 5, and we'll see how it goes. I will tell you that I have felt so good during this training block. Actually running my paces easier. I do think that if I kept training at what I could do, I probably would have burnt out earlier. But knowing that I need to do it this way is going to increase my longevity with the sport. So,
well, that's great advice also for a lot of young athletes, to recognize that burnout is real and preserving your body is important. And that cross training, whether it's strength training or something else, is really important. Renee, this has been awesome. Thank you so much for coming. Tell our listeners where they can find you, and tell us where you see Dr. Vegetable going.
So you can find me mostly on Instagram and Threads. Those are the places I live on social media. I don't really have other places at this moment. And I see Dr. Vegetable as something that's going to continue to take shape as I move through my career. I don't think that I will forever be a clinician. I think that someday I'm going to probably step outside the office in order to be more flexible with my family. And I think Dr. Vegetable is going to be the rest of my future, to be honest with you.
Oh, I love that. I can't wait to see what you and John do with this, and I can't wait to see how it's going to affect so many kids. So what's that saying again?
What's that?
The no crops, not box tops. Say it once so we can use it as a soundbite.
Shop crops, not box tops.
Say it one more time.
Shop crops, not box tops.
Love it. That's awesome. Coming to schools near you soon. All right. Thank you, Renee.
Thanks.
Thank you for tuning in to The Resilience Factor. If you're ready to build a stronger, longer-lasting body, make sure to subscribe and share this episode with someone who's ready to thrive. You can follow me at Dr. Pamela Mehta for more expert tips on strength, recovery, and orthopedic health. Until next time, stay strong, stay smart, and stay resilient.